So it is normal for us to lose hair. Every single day we have hair loss, normal hair loss. You lose about 100 to 150 hairs a day. And I'm talking about hair coming out of your scalp. Those are hairs that are supposed to come out. You're supposed to shed hair and then a new one grows. Um, some people get hair breakage, which is
Mhm.
not the same. That's breakage. That's not shedding. And that's damage, usually from how we're treating our hair.
Are you a busy woman who prioritizes everyone else's health above your own? Do you have questions about your diet, exercise, or how to prevent or treat certain health conditions? Are you always Googling health questions that you forget to ask or are embarrassed to ask your primary care physician? Girl, do you even have a primary care physician? Well, welcome to Headed to Healthier. I'm Dr. Brittany Anderson, a board certified family medicine physician, and every day in my private practice, I have discussions with women just like you who are doing their best to juggle the demands of life while also desiring to become healthier. Inside this podcast, you'll find practical and actionable health tips that you can incorporate into your daily life. You'll get expert advice and insight from some of my awesome healthcare colleagues, and you'll hear relatable conversations with incredible women just like you who have made their health a priority and are thriving because of it. So throw on your sneakers and get some steps in while you listen. Or if you're driving, get those hands at 10 and 2 and let's dig in. We are headed to healthier. Hey, ladies, welcome back to today's episode. I'm so excited to be joined by Dr. Dina Strachan, who is a board certified dermatologist and is here to talk to us about a really important topic, and that is hair loss. It's something that we see very commonly in women, especially as we age. Dr. Strachan, if you will just introduce yourself to us, and then if you will go ahead into a little bit about your practice, kind of what you're doing these days.
Okay. Well, I am a board certified dermatologist in New York City. I'm the founder and director of Aglow Dermatology, which is an independent dermatology office located in Manhattan. And we do medical and cosmetic, but I have a specialty in hair loss and skin of color.
Awesome. I love that. And you said something really interesting when you and I were just chatting before the talk. And, I was saying how this is such an important topic and I'm excited to be able to bring it to my audience. And you gave a just kind of an average statistic. Do you mind repeating that and maybe kind of highlighting
Yeah.
why this is such an important topic and one that I believe people will get a lot from?
Well, I mean, you have a 50% chance of experiencing hair loss in your lifetime,
Yeah.
most women. So, even if it's just something that's temporary, like you had a baby and you had that hair shedding afterward, you have a 50% chance of experiencing this, and it can mean a lot of things. So it's important.
Right. And the fact that it can mean a lot of things is one of the reasons why it's important to get it checked out, right? To not just assume, oh, this is something that's just going to happen because I'm at this stage of life or because I'm going through, maybe a stressful situation or something like that. But if it's something that is ongoing or even if it's something that's concerning to you, it's always important to check with your physician about it. So let's get into it. Let's talk a little bit about hair loss. So you've already mentioned how hair loss is something that many women see and something that a lot of people worry about. And when we notice it, there's sometimes maybe oh, is this something really bad? Or is this just something that's mild that I need to maybe not be as concerned about? What are some of the most common causes that you see in women as causes for hair loss? And we can be just kind of general here, don't have to get too specific, but if people are listening and wondering why they may be losing their hair, let's talk about that a little bit.
Well, my practice may be a little different than what you see in the general population. I see a lot of scarring alopecia, which is a category. There's scarring and non-scarring hair loss. Scarring means that the hair follicles are being permanently damaged and you may get some permanent hair loss or permanent balding, whereas non-scarring means that they're not damaged, so there is the potential for them to for it to grow back. And so I see a lot of CCCA, which stands for central centrifugal cicatricial alopecia. And it's basically a type of hair loss that predominantly affects Black women. And it tends to start on the top of the scalp and spread out. And it's associated with, in people who have like a genetic predisposition to respond to minor trauma on the scalp with balding. So even after, tight braids, tight weaves, heavy dreadlocks, pulling, and then you still get damage even after you stop doing that.
Hmm.
And that is what I see a lot of. But I see a lot of the more common things too. A lot of people also have male and female pattern hair loss, alopecia areata, which is that autoimmune hair loss. And then, people who are getting the telogen effluvium, which is there are a number of things that can cause it, from surgery, childbirth, fever, COVID,
Hmm.
medications, nutritional deficiencies, thyroid disease, syphilis. So hair loss isn't just all the same. A lot of people just think of it as the familial one, the male
Hmm.
and female pattern hair loss that runs in a family. But it can actually be a marker of other things that have to do with your health.
Absolutely. And I'm glad that you brought up telogen effluvium so early in the discussion. I don't know if it's viral on TikTok these days or what, but I've had several patients come into clinic and ask me about that. And the fact that they can even say it is mind blowing to me for one thing. But I kind of think about it, and correct me if I'm wrong, as like the hair loss related to stress, right? Regardless of what that stressor is, because it can be a physical stressor, just like you mentioned, childbirth or after a viral disease like COVID, things like that. And so, is there any other way that you describe that to people, or kind of what are thoughts that you would put towards that related to TEE or telogen effluvium?
Well, it's more like the hair shedding. It's actually true shedding. Everyone says their hair shedding, oh, I've been shedding gobs and gobs of hair for years. It's clogging up my drain, but they have a full head of hair. If you're shedding telogen effluvium, you don't have to convince somebody.
Mm.
It's obvious.
I like that. I like that differentiator there because you're right. So often, I mean, I say it all the time. I'll look at the back of my white coat. I'm like, I'm losing some hair here, but we're expected to lose hair, right? That's one thing that I spend so much time trying to explain to folks. Will you dig into that a little bit? Like, what does that discussion look like for you with patients for what you just said? That folks who may say, my sink is full or my floor is full of hair, but they've got a full head of hair. What do you think about
Yeah.
that?
Yeah. I mean, it probably isn't. Here's how you think of it. So it is normal for us to lose hair. Every single day we have hair loss, normal hair loss. You lose about 100 to 150 hairs a day. And I'm talking about hair coming out of your scalp. Those are hairs that are supposed to come out. You're supposed to shed hair and then a new one grows. Some people get hair breakage, which is
Mhm.
not the same. That's breakage. That's not shedding. And that's damage, usually from how we're treating our hair. It's getting dry and brittle from chemicals or heat. And then if someone is actually shedding so much hair that they get gobs and gobs, I mean, you go bald pretty fast. I got telogen effluvium after I gave birth, and it was pretty obvious. There was a significant amount of hair in my drain, different than what was normal.
Sure.
And you could see that I was losing my hair. I didn't have to convince anybody. It was
Mhm.
happening. So, that resolved itself, but it's normal to lose some hair. And then also you have to remember, if you have very long hair, if you lose one very long hair, it looks like a lot more hair.
Yeah.
So I have to remind people, some of my patients who have a lot of hair come in, oh, I'm losing so much. Look, look. I'm like, yeah, that's one hair. That's like six of mine.
Right.
And if you fold it up, it's just one hair though.
Gotcha. And a lot of women, in their 40s and beyond, as we've already talked about, notice changes with their hair. Other things certainly happen around this period of time as well, right? And so it's when we're starting to kind of go through perimenopause or, menopause. Some women are still around the age of childbirth and delivering, even into their late 30s and early 40s. What role do hormones or perimenopause or menopause play in hair loss? And is there anything kind of, again, we'll go general here, but anything that you'd want to share with the audience about that?
Perimenopausal hair loss is a thing, and you can think of it as female pattern hair loss that happens later in life. So, female pattern hair loss, which is also called androgenetic alopecia, is a genetic type of hair loss that tends to happen before you're 40 years old. And we think of it as some people say normal balding in a man,
Uh-huh.
but women get it too, and they can have it. It just looks different, where they tend to have more thinning in the front. They can get bitemporal thinning, where they get the sort of receding hairline in the front and on the sides, but it
Mhm.
doesn't tend to be as dramatic as it is on men. It's mostly in the middle and on a woman in the front, but that usually happens before the age of 40. Now, around the age of 49,
Mhm.
a woman might experience the same type of hair loss. It will look the same, except you're 49, you're not 40. It's perimenopausal hair loss. So it's the hormonal changes of perimenopause that give you like a female pattern hair loss pattern of hair loss. And then when you hit close to 60, there's another type of hair loss that some women get that it's not just women really. It's just they call it senescent hair loss where someone's hair is just thinner all over
Mhm.
globally. Like your body's like, I don't want to do that anymore. I don't
Hair
even,
thing. I'm
it's not,
done with it.
that's not a vital organ. It doesn't matter. I don't have to impress anybody. And
Right.
so it just doesn't want to grow as much hair in
Mhm.
general.
Are there certain lifestyle factors? So we talked about kind of telogen effluvium earlier and stress, but are there other things like psychological stress or other lifestyle things like our diet and even how we style our hair? You started mentioning earlier kind of some of the, hair weaves and braids and things like that. Other things that can make hair loss worse. So sometimes women who are already losing hair will do, styles that may be even more harmful to their hair, or women who are losing hair or having significant shedding or hair loss otherwise may not realize that there's some things that are in their diet or just lifestyle changes otherwise that they could make.
We'll start with diet that, having nutritional deficiencies. There's several different kinds that you can have that are associated with hair loss. You know, protein, vitamin D, iron, zinc is a
Mhm.
big one. Zinc actually anchors your hair into your head.
I
And
did not know that. I've
yeah,
learned it today.
yeah. And so an important thing to know about zinc when you get your zinc levels checked is that the blood test that we use to check for zinc is really a measure of the storage in your vital organs,
Hmm.
not your hair. So when you have a normal zinc level, but it's low, you can still have a deficiency in your hair because
Gotcha.
it's taken the zinc out of your hair to protect your vital organs to make your blood storage normal. So you should still supplement if you're losing, if you're actually shedding hair. And it's 60 and the lower level is 60 and it's like, well, I'm normal. You're probably deficient.
Right, right.
So those are important. So if someone's vegan or vegetarian, they're more likely to have uh, dietary, nutritionally related hair shedding. In terms of other lifestyle things, of course, grooming, that's more how it ends up damaging your hair shaft, like the hair itself. And then the grooming can cause traction alopecia, breakage, brittle hair, and then it actually sets off CCCA, conditions like
Mhm.
CCCA, where you continue to lose hair even though you stopped the tight style and the tight weaves.
Gotcha.
In
So,
terms of stress, I kind of feel like we tend to focus on stress. I mean, we don't really know how stress affects things. It's not generally a good thing,
right.
but I can't say that stress in general is going to make you lose significant amounts of hair. Life-threatening stress is different. I've had one patient that in all the years I've been practicing, which is like over 25, that has had nothing else, who was actually shedding hair that I could verify. I was pulling it out. I
Hmm.
could find nothing other than she had been in a terrorist attack and in an airport in India where bullets literally flew by her head.
Wow.
That's different than I broke up with my boyfriend or I don't
Yes.
like my job.
Right, right. Okay, so those kinds of things, we can maybe put that to the back of our mind if we're thinking of causes for hair loss, kind of the I won't call them common, but the milder stressors, right, may not be truly contributing to hair loss as some may
No.
think.
Make
Gotcha.
sure you don't have thyroid problems first before you say it's just stress.
That is so funny that you say that. I literally was talking with a patient today about this very thing. Maybe it was yesterday actually, because we checked labs and got them back today, and 100% the thyroid is abnormal, and it's here it is. It's not, the stress that the quote unquote stress that you described to me. It is something that I can put my hand on. We can treat this and let's turn that around. So very much. Now, again, I was mentioning earlier kind of the telogen effluvium craze on TikTok, it seems, and I assume that's where people are getting it from. I think sometimes that's where people get many things from, and they're not getting that information necessarily from physicians, from people who are board certified in certain areas, which is why, again, I'm so glad to have you here today. But we see so many products that are out there, products and these treatments that, promise thicker hair. From a dermatologist perspective, what do you think about just that in general, about these, mirage of products that are there and people really taking a little bit of time to put some stock into, okay, what is this product that I'm actually putting on my hair or taking in by mouth? And is this actually going to work or is it just hype?
I think that you have to be very careful that one thing it's important for people to know that hair length and density to a certain respect is genetic, you
Mhm.
know, and there can be things that we do that might thicken our hair a bit, even when there's not like a deficiency or a problem. But a lot of that is genetically determined. You know, even the texture of your hair is genetically determined for a reason. So, like the curlier, kinkier hair textures are designed to be short and break because they came about. This is from the research of hair anthropologist Dr. Tina Lasisi, who studies why do humans have hair texture differences.
Mhm.
And the thing she found, like with African hair texture difference, was that people were evolving. We lost the hair on our bodies and we kept the hair on our head. Why? It was to protect our brains from overheating in the sun.
Oh, sure.
And
Okay.
so you didn't want long hair to heat up your body. So you'd want your hair that would break.
Right. That's so interesting.
Yeah. And then you want it to like create insulation so it grows out. And so that afro kind of creates the insulation from the sun
Hmm.
to protect your brain. And then if you were someplace cold, your hair, you'd want to come down and cover your body. So a lot of these things that they're promising to change something that they may not be able to change.
Right. The genetics they don't change, right? A new
Yeah,
hair oil or serum is going to
yeah,
change
it's
your
not, yeah. And then also, people I'll use the term snake oil. I mean, and I read
Yeah.
about hair a lot in the hair industry from the business side. There are lots of people who are like, "Oh, the hair industry is about to blow up. We're going to make some mad money." But
Yeah.
a cosmetic, remember if you buy something, if it's a cosmetic versus a drug, cosmetic doesn't have to actually do anything
Right. Right.
other than it's used to beautify, and beauty is in the eyes of the beholder. Actually growing hair, changing the structure and function of your hair makes something a drug. And
Hmm.
drugs actually, are supposed to have data to show that they actually. So I would be very careful at the promises of a any particular product
Hmm.
that you buy that says it's going to make your hair actually thicker, actually longer. It might give the appearance, like there are things like volumizing things that can give the appearance. And there's supplements that can help a bit as well, but I would be more cautious
Gotcha.
because
Gotcha.
there's so much that people are trying to sell
You're right. I
does
feel like,
nothing.
yeah, that's nothing. I think that you're exactly right about that. And so I think that goes back to the point that we were making earlier is get that checkup done, make sure you're not truly deficient in something that needs to be replaced, because then it goes back to your whole discussion about a drug versus something that is cosmetic, is that, getting those replacements in, if you are deficient in something, really does perhaps actually give you the chance to turn that around as opposed to something that may, I love how you said, give you the appearance of some improvement, but that may be something that's temporary and fleeting. And by the time you realize that it's temporary and fleeting, you've spent hundreds of dollars on buying that product. And in wrapping up, kind of think about something practical to leave our listeners with that if someone today is noticing more hair in their hairbrush or on the shower drain or on their bathroom floor, what is the first step that you as a dermatologist would tell them that they should take?
So, from my perspective, I feel that someone should get a proper evaluation by someone who actually knows how to do it. Dermatologists are the most expert in hair loss, but even among dermatologists, not all dermatologists
Right.
do a
Yes.
lot of hair loss in depth. And so, because hair loss can mean you have lupus or you have a nutritional deficiency or you have a genetic disease, I think you want to make sure you're getting a thorough evaluation. You want to get a proper diagnosis before you start treating.
I really appreciate the discussion and us being able to talk through hair loss again, so common as it is. Any closing thoughts or anything that you'd want to share before we get into a little bit more about your practice?
I mean, my that's my little crusade is get a diagnosis for your hair loss because people use the term alopecia and hair loss a lot, and they actually mean the same thing. And they're often referring specifically to alopecia areata, and
Mm-hmm.
they're talking about different treatments that they want. And so that can delay the diagnosis. It can mean you lose your hair permanently if you delay too much. So treat it like you would treat any other medical problem. Don't jump the gun and say you're going to start treating with X, Y, or Z before you know what's happening.
Absolutely. I love that. And you mentioned already a little bit about your practice, but tell us, are you active on social media or if people want to follow along just to learn more about your practice or what you're doing? Tell us where we can find you. And if you're driving or out for a run or something, don't worry, I'm going to tag it in the show notes. But Dr. Strawn, let us know where we can find you.
So you can find my practice at dinastrachanmd.com. That's DINASTRACHANMD.com or Aglow Dermatology, which is what it's called. Both will take you to the same website. You can find me on Instagram uh, at Dr. Dina MD. That's DRDINAMD, or my practice, Aglow Derm NYC on Instagram. And then we also have an Aglow Dermatology YouTube channel.
Oh, I love that. Wonderful. I have to find your YouTube. I've followed you on Instagram and know about the great work that you're doing there already. But definitely a space for education, right? And a space for more education for patients, for physicians as well, for primary providers. And one of the things that I tell my patients, and I tell them this about many things, but dermatologic things and hair things especially are no different, is that here at my office, at your primary care office, we can cover some things. We can look and say, hey, you know what? I think that it's related to this. Let's go ahead and treat that. This looks like it. Back to the thyroid thing. But if we're checking labs and we see nothing there that goes to explain it, but women are still having issues, or people in general with anything are still having issues, one of the things that I'm encouraging our listeners of this podcast to do is to really take control of your health, right? And it is okay. I tell my patients this and I tell my listeners this. It is okay to want another opinion, right? It is okay to say, I know at my core, deep down, something is not right. And we had a previous episode that was along the lines of, my labs are normal, now what, right? Because that so often happens. And I would assume that in your specialty practice, that you see the same thing, that people may come to you and say, you know, my primary doc said that everything was okay, but I know something's not okay. And it's what you do. And I love how you mentioned the importance of finding someone when we're talking about hair needs who has a focus there specifically. And so I love that. And if I could leave some closing thoughts with listeners, whether it is related to hair loss, weight changes, mood changes, etc., absolutely check it out with your primary doc, that doc that you are familiar with and know. But if there ever comes a time, even if it's with a specialist of another kind, that you think, you know what, I think there's more going on here than we've gotten to, it is okay for you to take that next step to get the care that you need to live your best health. Dr. Strawn, yeah, Dr. Strawn, thank you so much for joining us today. It's been a pleasure to have you. I'll be sure to tag the link so that folks can find you in the show notes. Ladies, I look forward to being here with you next week on Headed to Healthier. Bye. Hey, thanks for listening in today. I hope something you heard in this episode will help you on your journey to becoming healthier. Remember, this podcast offers general health information. I am not your personal physician. If you need advice that is specific to you, be sure to consult your physician. If you enjoy this podcast, please consider sharing it with a friend and reviewing it on Apple Podcasts. Also, be sure to subscribe to the show so you never miss an episode. Tune in next week for another great episode of Headed to Healthier. Until then, take care of yourself. Talk soon. Bye.